there's a lot of different ways people are getting care.
Right.
And you know, some of it you don't want to talk about too openly because you don't want people to be targeted, right? But
Right.
there's a lot of different ways people are getting care.
Right.
I know of a small group of people, I'm not even going to say what state it is, who are uh, working full time at other jobs, but who collect whatever money they can every month and help to try to get 20 packets of pills to people every month.
Right.
And then there's folks who are hairdressers in certain places who are known to be the people that have stuff to give people. So,
Right.
there's just a lot of, as if you go back, and you know this as well as or better than I do, if you go back and you read the literature about what people did before Roe, that's what they did.
Right.
They helped people sort of in the underground space. And we're going back to that place, which is a bad place to be because many people don't get care. And we are already seeing in Texas, for example, the United States has one of the worst maternal mortality rates, deaths due to pregnancy in the world,
Yeah.
especially at the level of economic development that we
Amongst
are, right?
industrialized rich countries.
Yeah,
Yeah. Yeah.
really one of the worst.
Yeah.
And in Texas, as you can imagine, Louisiana, it's really awful. It's among the sort of averages, they pull the average, right? So in Texas, you had really high rates of Black maternal mortality that even as early as 2012 and 2013, people were documenting and raising alarms about how high Black maternal mortality in Texas is and
Yeah.
was. And now we have found that post Dobbs, it's skyrocketed even from there.
Hmm.
So the number of women and Black people who are dying from abortion, I mean, pregnancy related complications has grown. And then there's also a steep rise in infant mortality as a result of Dobbs in Texas. So, these individual stories that make it to the press and that are heart-wrenching are just examples of the things we don't hear.